The National Cancer Centre of Mongolia is a state medical institution that is responsible for the early identification of cancer prevalence amongst the population, investigation and prevention of risk factors that lead to cancer, and early detection, diagnosis and treatment of cancer at a national level. The NCC aims to be a leader in provision of quality, client-friendly, equal and accessible cancer care and services nationwide. Our centre is responsible for supporting the Ministry of Health in developing cancer prevention and control strategies and monitoring their implementation. The National Cancer Centre was established in 1961 as the State Radiotherapy Hospital. In 1982, its name changed to the State Cancer Centre. From 2006, it has been named the National Cancer Centre. The National Cancer Centre intends to provide integrated and holistic client-centred clinical and public health services. Common management and coordination of 19 divisions, departments and units ensures we are able to provide these services effectively and efficiently. The outpatient clinic is responsible for outpatient and daycare services, and the inpatient clinic, with a capacity of 190 acute and 16 palliative care beds, is responsible for inpatient services. The staff of our centre, which consists of 104 medical doctors, 125 nurses and other support staff totalling 433 people, is united under our vision to provide quality, client-friendly, equal and accessible cancer care and services nationwide. The outpatient clinic is responsible for reception of clients, diagnostics, daycare and treatment, and referral of patients to the inpatient clinic. Furthermore, the outpatient clinic conducts periodic screening amongst different groups of the population, as well as provision of specialised clinical reference for secondary level district and province hospitals. The outpatient clinic provides specialised consultations and diagnostics on general oncology and surgery, including surgeries for liver and pancreatic, head and neck and gynecological cancers, as well as cases that require radiotherapy, chemotherapy and palliative care. Radiologists of the outpatient clinic conduct diagnostic imaging and treatment procedures using modern digital X-ray, endoscopic and ultrasound equipment. We are trying to improve current service by initiating advanced technologies in surgical, chemotherapy and radiotherapy. The surgical clinic provides surgical services nationwide for all types of cancer except those that require neurosurgery. In recent years, our surgeons have introduced and now routinely perform internationally recognised techniques. These include transhiatal esophageal gastrectomy, portal vein ligation, laparoscopic assisted vaginal hysterectomy, distal pancreatic ectomy with radical lymphadenectomy, parotidectomy using harmonic scalpel, and many more. The surgical clinic consists of 5 divisions: General Surgery Division, Liver and Pancreatic Surgery, Gynecological, Head and Neck Surgery, Intensive Care Department. The non-surgery clinic provides nationwide cancer-specific non-surgical services such as radiotherapy, chemotherapy and palliative care. Transition from 2-dimensional to 3-dimensional technologies in radiotherapy, expanding the types of drugs and using advanced methodologies for chemotherapy, and the introduction of international guidelines and protocols in palliative care are ongoing achievements of this clinic. The radiotherapy department conducts radiotherapy for all types of cancer using 3-dimensional planning and radiotherapy equipment with CO60 source. 3D radiotherapy planning is performed with our CT and radiotherapy is completed with CO60. We are aiming to shift from 2D to 3D radiotherapy and introduce LINAC. We provide chemotherapy for all types of cancer using more than 10 types of drugs that are commonly used worldwide. We are aiming to expand the chemotherapies we use and introduce advanced methods. The Palliative Care Department provides hospital-based palliative care for patients with a broad range of cancers diagnosed at late and incurable stages. In the future, we aim to develop a guideline that is in line with international standards, as well as train local doctors to become palliative care specialists. In the future, the centre will be a training centre for palliative care. Our centre is the first national medical institution that provides specialist oncology psychosocial support for patients, carers and their families. Evidence-based theoretical and practical support and interventions are provided by full-time specialists, including psychologists and social workers. The Research and Training Department is responsible for cancer registry and supplying data on cancer prevalence, morbidity, mortality and cancer care and services for decision makers, overseeing policies on cancer research, dissemination of information on cancer prevention to the population, and management of information technology in our centre. The division also organises and coordinates postgraduate training of oncologists. Our centre is responsible for increasing people's awareness about cancer prevention through planned activities. We also organise campaigns such as Together Against Cancer that aims to improve early detection, enhance local oncologist capacity nationwide, as well as spreading information through media, for example television, media and newspapers.